Using the Derma roller for hair loss. If you are male or female and experiencing baldness, thinning hair or alopecia, hair loss, the Derma roller can help. It is used to stimulate hair growth, and can be used in 2 different ways to help repair hair loss. Method 1. Using the Derma roller with minoxidil. Method 2. Using the Derma roller without minoxidil. How to use the Derma roller for hair loss. If using method 2, simply follow the instructions below without using minoxidil. The most effective way to use minoxidil with the Derma roller is to first roll the scalp with the Derma roller, then apply minoxidil to the rolled area, although if you prefer you can apply minoxidil first, then use your Derma roller to roll it in. The Derma roller creates temporary channels in the skin. These channels close within 30 minutes to an hour, so it is essential to apply the minoxidil as soon as possible after rolling for maximum effect. Start with 2% minoxidil and apply it with the Derma roller every other day. If you do not experience any irritation or other side effects, you can start applying it every day and/or start using 5% minoxidil. Derma roller for hair loss instructions. 1. Wet your hair before using the Derma roller on your scalp. This will help prevent your hair from getting tangled in the roller. 2. Begin using the Derma roller at the front of the scalp on or near the hairline and work your way down the back of the head, treating only the areas where hair loss has occurred. 3. Focusing on one section of the scalp at a time, roll each area 10-15 times. You can do this by rolling horizontally, vertically and diagonally, 3 or 4 times each way. Roll in one direction only when the needles are in contact with the scalp, don't go backwards and forwards, and try to roll from the hair roots to the ends. This will prevent any hair getting caught in the needles. 5. Repeat this process until you have covered all areas needing the treatment. 6. Apply minoxidil to the treated area and massage gently into the scalp. You only need to apply a moderate amount of pressure. Rolling too aggressively won't give you better results and can cause skin irritation, scratches and/or needle marks. Which size Derma roller for hair loss? Which needle length you need depends on whether you are using method 1, using Derma roller with minoxidil, or method 2, Derma roller only. Method 1. Use a needle length between 0.2 mm and ½ mm. Never use a needle length longer than ½ mm with minoxidil because the active ingredients in the minoxidil can absorb too deeply into the scalp, causing side effects. Method 2. Use a needle length between ½ mm and 1.0 mm. How often to use Derma roller for hair loss? A 0.2 mm or 0.3 mm Derma roller can be used with minoxidil every day or every other day. Start by using every other day and see how your skin reacts to the minoxidil. If you do not experience any side effects, you can increase to using every day. A ½ mm Derma roller can be used with or without minoxidil 2-3 times a week. A 1.0 mm Derma roller used without minoxidil can be used once a week to once a fortnight.
Thank you for watching. Please click the subscriber button and join our channel for more articles.